Lyndhurst, New Jersey, by the name of Index, which is 10,000 employee live school districts that are still our client today. And like I mentioned, we have clients everywhere now. So it's very humbling to be here. It's fantastic to be here, and I have a lot of information to share. I will try to make sure that when I use terminology that I assume everyone will know. Actually, I shouldn't say that because I talk to a lot of brokers, okay? Usually the stuff I'd say goes over their heads too. So I'm just going to try to keep it as simple as possible. But remember one thing. I talk to, on a normal basis, brokers, okay? In my opinion, more than a TPA, more than the stop-loss carriers, more than the large insurance carriers, whether it's Blue Cross, Cigna, whoever you want to, the Bucas, United, Cigna, Aetna, etc. Brokers have more power than anybody. If you want to get to the employers, you have to convince the brokers that it's the right thing to do. Otherwise, it's not going to happen. Because the employers are the ones who are paying the broker to tell them, how should I do my health benefits? That's the connection right there. So I make sure that I basically speak to brokers every single week. So usually I'm speaking to an audience where there's a lot of skepticism, okay? These are guys who want to golf on Friday. They want to golf on Monday. They want to golf on Tuesday too. It's a lot more work to do a lot of the things that we're going to talk about today to be a perfect self-funded plan, to have a truly free market, to make a contract with Dr. Keith Smith's facility, which my company has had for 2 years. We're in Boston. Okay, we've been doing this for a while already. But the point is, the brokers are the key because the status quo is very easy from the broker's perspective. All right, we have a renewal. Here you go. Here's a piece of paper. Yeah, we're going to increase your copay. You can increase your deductible, but your premiums are going up. That's the reality of the world. But more and more brokers nowadays, and the reason I can tell you this as a fact, more and more brokers are looking for alternatives because more and more brokers are asking me to come and speak to them. So I know that the brokers, and I tell them all the time, I was in, like I said, Midtown Manhattan last week, and I told a group of brokers, I said, my job is to make you a Superman. My job is to turn you into a superhero. I'm going to make it that client will never leave you for any other brokerage firm because the stuff you're doing, nobody else is doing. That's the sell. And it sounds maybe a little weird, but that's the only way to get into the employers. When you realize that so many employers right now are throwing so much money down the drain and they have no idea why, and their broker's doing nothing about it. That's the American way right now in this country. It is. That's our healthcare system. So until more employers start asking questions and more brokers start changing the way they do things, nothing's going to change. Quickly, I'm a self-funded organization. My company is self-funded ourselves. We have 150 people at our organization. Like I said, we started with 2. Half those people are my family, which is not a good thing. It's horrible. I'll talk about my Aunt Denise later on in a couple slides. I mean, it's just it's bad news sometimes. Anyways, try to fire them and then see them on Thanksgiving. It's not fun. Anyways, I talked about our company. I talked about our history. As I mentioned, it's an honor to be here. Let's go to the next slide if you don't mind. Okay, the mission. To me, when I read this a couple times before I came, right, and I looked at the theme and the mission, and I bolded the parts that I thought were most important. Practice free market medicine without the intervention of government or other third parties, okay? To me, it's less about the government in my business. It's more about third parties, okay? I know Corey, I'm a big fan of Corey Cook. You all heard her speak yesterday. I'm a huge fan. She talked about multi-plan, right? And somebody said, what is multi-plan, okay? Basically, at the end of the day, most employers, most carriers, everyone has a network of facilities, as you are all aware. Those organizations are my biggest enemy. That's the biggest impediment to actually getting anything done. Those contracts, which many plans who have agreed to the terms of those contracts have never seen. You're agreeing to terms, to contracts you've never even read. Never mind understand what they are. You've never seen them. And they've been in place for 10 years. So you try to start doing some innovative things and you realize you get a cease and desist letter. We get a cease and desist letter in my office every day. I do, okay? They are not a fan of mine by any means, none of these organizations. So it's important that you realize that, yes, the government's involved, but I take the government involvement with a grain of salt. The government involvement, in my mind, actually helps us because it makes people aware of the problems. It does. When you look at the third-party contracts that you have, no one's talking about them, so the employers aren't aware there's a problem. With the government, at least there's something to complain about. And I can go, oh, you're complaining about it? Well, here's how I can fix it. Whereas with the contracts, silence. It's like church, okay? Oh, maybe, well, that's my church. I'm a Catholic, okay? If you ever been to, anybody else here a Catholic? It's like one. There's like 5 of you, great. You know, it's like Catholic church, right? No one's happy, right? Everyone's like really sad when you walk in there. You know, it's like, you know, very God-fearing, right? Like well, at least with my mother it is. Anyways, the theme of this conference is to save money and get better results. The overall theme right there, save money, get better results. That's what I'm all about. My job is to reduce the cost of care. My plan at my organization, the cost of our plan has gone down 25% over the past 3 years. We've added every year 20% each year to the population of the plan. So it's important to realize everything that I'm talking about today, this isn't theory. This isn't some, you know, Harvard Business School study. This is stuff that I do now with clients all across the country. So these are things that you can be looking at as potential as well. Next slide. Okay, overview, there's a lot here. I got about 1 hour and 15 minutes. I will fly through this, trust me. If you have a question, please raise your hand. Actually, don't raise your hand, just yell it out. I will pick on people in the audience, okay? I do that all the time. So folks, those of you who right now are looking down at your phone or your iPads, I like to call on you specifically, okay? It's like law school, the Socratic method, when they just pick out kids in the audience, that's horrible. I mean, I went through it. You know, these guys love it, right? The professors love picking on these kids. But I won't, if I see someone that it's just so obvious to pick on, I'm going to pick on you, so I apologize ahead of time. But it makes it a lot more fun, okay? So let's just see what happens. It's Saturday morning. Let's all enjoy ourselves. Okay, we're going to talk about cost being the problem. We're also going to talk about the growth of self-funding, how it's grown, the benefits of it. We're going to talk about what you can do. ASO versus TPA. ASO and TPA are two very different things. Very simple. Self-funding is not the same. Not all self-funding is the same. It is not all equal. You're going to have two employers both saying that they're self-funded plans. One can do everything that I'm talking about, and the other one can literally do nothing. Nothing. And it's not their fault they can't do anything. They don't have the fiduciary duty to do it. So, fiduciary, control. If you don't have the control, if you're a self-funded plan and don't have the control to sign a contract with Dr. Smith or to have a free market option, then you can't do anything. And that's going to be specifically listed in the contracts that you sign, the fiduciary duty. Who is it with? Is it with the plan or is it with the actual administrator/carrier? Important note. The risk spectrum. This is a fun slide, fun stuff. Where in the risk spectrum, okay, left to the right, is that particular employer? Where do you feel comfortable being from a standpoint of taking on risk? We're going to talk about that. We're going to talk about the PPOs and the networks, the anti-free market, in my opinion. It is. It's amazing. I know Dr. Smith talked about it yesterday. I'm going to give you some real details to see some of the stuff that's just happening across the country. And last, the free market solution, innovative plan design. Nothing I'm talking about can exist. Nothing that I'm talking about can occur unless you have the plan design to back it up. So, for example, if it says specifically in your plan that you are not allowed to have foreign care, 99% of you in your health plan right now, it says you cannot have any foreign care. So you can't go to Guatemala for medical tourism. Okay, then why would you start a medical tourism program to get your people to go to Mexico, Chile, wherever for surgery if your plan document says that it's excluded in the first place? That's an example of what I mean by innovative plan design. Next slide. Okay, really important when I talk about the cost being the problem and self-funding being the solution. My company's overall mission is to empower plans. Yeah, that's what we call it. It says a FIA group, empowering plans. That's our goal, that's our mission, that's what we stand for. It's hard to empower plans when they don't even know they have power to do it. And that's why I go back to the broker situation. Unless you can get these employers to understand that they can actually control the cost of their healthcare costs, nothing's going to change at all. No one wants anything to change. Like I said, I speak to a group. All right, everyone heard of Willis, Gallagher, Benefit Mall, the big brokerage houses all across the country. Everyone locked in, okay? Big companies. I go to some of these sessions, and these guys are in the audience. We're not talking about some customer service rep. We're talking about a senior guy who's been in the business for 30 years. And I'm talking, and he's sitting there shaking his head no. These people represent your companies. These people represent your clients. These people represent the employers in this particular area who have no idea about some of what's gouging that's going on. Corey talked about it a little bit yesterday with dialysis, okay? I hope and pray I never get end-stage renal disease. I won't have a facility to treat me. DeVita and Fresenius hate me. They must have a bullet. They must have like a dartboard with my face on it. Because those two organizations, I will do everything in my power to shut them down. I don't care. I came from nothing. My mother moved to America in 1973 with no money in her pocket from Poland. Okay, so when I heard the story, talked about your story yesterday from Egypt. My mother came to this country. You guys like Polish, Russo, you know. My dad came from Sicily in 1973. They met in English second language class in high school. They couldn't talk to each other but got married. By the time they could talk to each other, they had a divorce. They were divorced less than 2 years after they got married. So I was raised by my mom in an all Polish neighborhood. I speak fluent Polish. I can read it. I can write it. Anybody here can speak Polish? I'll prove it to you. I know someone didn't believe me yesterday. You know that because I took you to the Polish club, Mr. Archer, 2 weeks ago, right? We had some nice kielbasa together. Anyways, the point I'm trying to say is I believe in a free market. I believe in giving people opportunities. But the problem is, in the way our healthcare system is set up right now, is most people don't even care. Most people don't even know. If you ask a typical employee at any health plan, at any company, what is the bill? How much are they paying? Their answer is $25. No clue. Go talk to a union plan, like I do, the offshore drillers in Louisiana that I represent, or the entire state of California self-insured school districts that I represent, or the basically mafia guys on the docks in New York City that I represent their union too. Literally, I see people like kissing rings when I go to their meetings. Go tell them, ask them what their cost of their bills are. It's $10. That's their copay. I pay $10. Or I pay $200 for an emergency room visit. That's it. There's no concept, no idea that there's any other bill out there that's being paid by it's all being paid by some imaginary person. I pay my premium. I pay my union dues. That's all you hear. Until you can change that mentality, quite honest, none of this is really going to take full steam unless that idea, those ideals change in our public's perception, especially when it comes to employer-based care. So, based on that, why do employers finally care about costs? And secondly, why are medical costs so publicized now, okay? I'm not talking about the $40 aspirin. I don't care about the $40 aspirin, to be quite honest with you, okay? I know folks here, what do you mean he doesn't care about the $40 aspirin? I don't. I'm looking at claims over 1 million. 100 of them, okay? Last year, in 2013, in my organization, we saw a total of 14 claims over $1 million. This year, so far, we've already seen over 80. 80. We're all the people I represent. Sun Life already has over 27. Sun Life alone has 27 claims over $1 million. Highmark alone has over 30 claims over $1 million already this year. From all the different clients all across the country. For all different things. You know, high-risk pregnancies, who knows, hemophilia claims, you name it. And it's amazing how much it's jumped. So that's, I think, when you talk about medical costs, people hear about the aspirin. Have you ever heard about the dialysis charge for $80,000 for a month? No. You don't hear, it's not sexy enough in the media. It's not. It's not interesting enough. They rather have it, oh, a Band-Aid is $50. Or this is $30. Ooh, how is that pill $30? I could buy it at Walmart for 3 cents. That's there, I get it, but when I'm fighting this fight, folks, there are not many people that do what I do in this country. There's just not. Corey Cook, I'm trying to think, I can't even name you 5 people that do what I do. That's probably a good thing for me, right? But there aren't that many of us. And that's the problem is, when I look at, all right, which battle am I going to hit? I'm not going to hit the Band-Aid at battle. I'm going to hit the $300,000, $500,000 claim battle first. So why do employers finally care about costs? I think they've always cared. Yes, sir.
Do you think that one of the reasons why we're seeing...
You told me you were going to be picking on me beforehand, right? No, are you being serious or you just messing with me? Because you told me 5 minutes before I started, I'm going to be badgering you all the entire time.
Your talk's been good so far.
Okay. Yeah.
Do you attribute the higher claims costs to perhaps PPACA, with regards to not having limits on benefits plans anymore?
You think? Is that a coincidence? Yes, sir.
We're in the medical malpractice insurance business, and our national carriers are telling us that ACA is
trying to give me more work? It's a new industry I could be in now?
Rates have come down probably 50% in the last 7 years. They're getting ready to go back up 50% over the next.
Interesting. But I can tell you that I would say most of this stuff is, these high-cost claims, I would think there's a direct correlation to the fact that there's no longer a $1 million maximum on employee benefit plans, a typical plan, or even a $2 million max. Yes?
Can you give us the most dramatic price reduction that you forced on?
Can you give me like 20 minutes when I get to that slide? I'm just messing around. Just give me a couple minutes and I'll do that. Yes, sir?
I've been in this business for 50 years, and I asked Everest Re's president last year the largest bill charge that they had seen in 2013, and I was flabbergasted. 20.6 million. What can you do to somebody for 26 million?
Well, no. That's the point. Keep them alive.
The $6 million man was only $6 million.
Yeah, but with inflation, a $6 million man is probably like 60 now, right? I'm guessing. Okay, so let's go to the next slide. So this is an important slide to me. I love doing this slide. I think it's pretty interesting, okay? What's happening right now in the market? What's happening in the media, okay? Everyone remember that movie Sicko? I'm assuming there's a bunch of doctors here, right? Everybody, can you raise your hand if you've seen the movie? Okay. And how many of you have read the Time Magazine article, The Bitter Pill, right? Okay, this is more than usual for me. Usually it's like one person that's seen each one of these, so it's interesting. But this, to me, is a clear example of why this organization, to me, will thrive, will prosper. And it's because of the movie Sicko and versus the Time Magazine article. In the movie Sicko, long story short, I'll make it long. Travis, you picked a bad spot to sit in, just so you know. I apologize, but you didn't know. You look like a nice guy, so I'm going to be really, really tough on you today. He's the main actor in Sicko, okay? We're going to knock on wood on everything I say, okay? He's got a beautiful wife. He's got 2.2 kids. He's got the dog. He's got the cat. Beautiful white house, big white picket fence. He's got the whole thing going. He gets a really big claim. You have a very bad sickness, and you are hospitalized. And there's over $1 million in charges. And you, because you're just a smart guy, decided to buy the worst possible health insurance policy in the world for $5 a month called Mega Health and Life Insurance Company, okay? Mega Health and Life Insurance. Just the name of the company alone would make me not want to purchase health insurance from them. Mega Health and Life. It just does not sound very cozy. Am I crazy to think this, okay? So what happens? Mega Health and Life excludes all coverage for all these outrageous and crazy diseases, one of which, Travis, you have. So they deny all your claims. So what happens? You're not covered. The hospital comes after you. They bankrupt you. And guess what happens, Travis? Your wife leaves. She takes the kids. She takes the dog. She leaves you with the cat that you hate. And the camera shows you on the front porch, sitting there on the front porch of that house, right? All alone with the music in the background, violins playing. And they show you and they say, look at our horrible health insurance system. Why is this health insurance carrier doing this to Travis? Where in that movie did they ever one time question, how in the world were the bills so high that it could bankrupt Travis and have his wife leave him for the next door neighbor? Nowhere. It wasn't even a question. It never even contemplated the mind of the director as to why the bill's so big in the first place. Just why isn't it covered? That's the American mentality. That's our psyche in this country. That's the employers, like I said, 5 million employee lives that I represent, not including their dependents. That's what they're thinking in many of them, unless you change their perception. The bitter pill, which is historic, by the way, the bitter pill, it was the only time in Time Magazine's history that the entire magazine was dedicated to one article. That's part of the problem with the article, is that it's too long, okay? People can't read that much about healthcare, I don't think, in one setting, right? It's like 3 months on the, in your toilet. Maybe you can finish that Time Magazine piece. But at the end of the day, it says why medical bills are killing us. It took that perception of, forget the insurance companies for a second. Why are these bills so high in the first place? What is a charge master? Who is this guy? Is it like a person on a hill that's this charge master? I can just see the guy with this big bolt of lightning coming down. I mean, literally, what is it? I've had more discussion with facilities. Where do you get this charge master from? There is no answer. And the magazine in 75 pages basically says the same exact thing. But it shifted the talk. The discussion went from the big bad insurance company to why do we have these big bills in the first place? Go to the next slide, please. Okay, self-funding by the numbers. This, to me, folks, is where I talk about brokers. And it's important. In my opinion, the only way the free market works is if employers are self-funded. I think if it's a fully insured plan, none of the stuff that we're talking about is possible to happen because the carriers in the fully insured business make a lot of money in a lot of different ways, okay? They're making money on those contracts. They're making money on the bills. They're making money on the admin fees. They're making money in every different way, and they don't want to mess up that dollar train that's coming through town. Okay, that's a lot of money coming through. A self-funded plan where you have risk, you have control of your plan dollars, you care about the employees that work for your organization, that's really where you can make a difference. And that's why I was asked to be here, I assume, is to talk about how self-funding in this world makes sense. Folks, I talk about Dr. Smith twice a week. I talk about him in every single webinar, not just him, Oklahoma Surgery Center. I talk about every type of organization that does what he does. And when I bring up his name or I bring up these things, the same brokers that are literally shaking their heads, every one of them looks up from their iPad and starts listening. Every single one of them. When I tell them the small little, you know what? Play 18 holes today instead of 36. And just do this. They all look up and they all start smiling and they go, man, I can make some money doing this. They can make money. Again, this isn't altruism. They can make money by putting some of these programs in place. So I bring this up because self-funding to me is really where this is all going to go. And I'm very happy that when I started my business, I decided to focus on self-funding back in 2000 because you can see in 2000, 49% of all employers, all sizes, were self-funded back in 2000. It's over 60% now. All employers, all sizes. This information came from Thompson's, by the way. Okay? I'm actually the contributing editor to Thompson's Guide to Self-Funding, so I write articles for them every single month. I know what's going on in the self-insured world, and I can tell you that this self-funding is still continuing to grow, which may not be a good thing. I'm going to talk about that a little bit later. But here's the question I got, and I want someone to answer this. Travis, you answer this question for me. On that top one, right, it says 93% of employers with over 5,000 employees are self-funded. What's the question you think I'm going to ask? What's the comment that you would have on that? 5,000 employees. You're a huge company.
They've got the fiscal capability to share risk.
They do. But the answer I wanted, listen, I'm sorry, man. I buy you a drink, but it's like 10. So, you know, it's 9. It's 9. My watch says 10. All right, I'm in Boston time still. The question is, why isn't that 100%? Okay? 7% of these massive companies who can control the market in their area, they can literally, hey, I'm sure they golf with the local hospital's CEO. Hey, let's make a deal, man. I got 5,000 people. No copay, no deductible. I'm going to send them all to your facility. Let's make a price. And instead, they're paying a premium to Blue Cross. It's crazy. There's 7% of these companies. You think they're working directly with Blue Cross, or do you think there's a broker in the middle? And what do you think that broker's making on that deal? Hundreds of thousands of dollars. So when I see this, yeah, it's up from 72% to 93%. I want to find these 7. I want to talk to them. I want to contract with these guys. I'll be their broker, okay? And then I definitely won't be back here next year. Next slide, please. This is interesting, right? And the folks that talk about healthcare reform, okay? I love you folks, okay? Obamacare, I call it Obamacare because Obama calls it that. I don't care, it doesn't matter. I call Romneycare, Romneycare. I'm from Massachusetts. I am from the communist state of Massachusetts, okay? It's not that bad, okay? Yes, we have to salute the governor when he walks by. But it's not that bad. We have some freedoms there. You know, you can actually have a gun on the 3rd Sunday if it's a full moon. You can carry a gun. But the reason I bring up Massachusetts is this is where all this started, okay? Folks, listen, I am not a Democrat. I am not a Republican. I think it's all a big sham, no matter what you do. It's all the same, in my opinion. It really doesn't make a difference. Because, folks, if you're in here thinking that the Republican plan for self-funding is better than the Democratic plan for self-funding, you're crazy. We're better off with the Democrats in office because the Republican plan would not have employer-based coverage either. They want individual to make the decision. If you look at most of the plans out there, it's worse on the Republican model for self-funding than it is for Democrat. That's another discussion for another day. But at the end of the day, I came from a world where Romney was my governor and we had Romney Care, okay? For those of you who are going to tell me that Romney Care is so different than Obamacare, okay, great. My wife is an artist, so obviously she is an extreme liberal, which is awesome, actually. It's much more fun on a Friday night to have a discussion with her than if someone just agrees with me all the time like John. I mean, my guys have to agree with me all the time. It's nice to go home and never be agreed with. It's sort of fun, right? We've been married for 7 years and it's going great. But the point I bring up is we have Romney Care. It's the same thing. I had the option to drop health care coverage for all of my employees and put them through our connector plan, the Romney Care plan. I didn't. And most other employers in my state didn't either. Why? Look at this. If you look at this bottom chart, that's overall all employers, 50 lives or higher, 50 people working for them or more. That is a chart of the growth of self-funding. Now it's at over 68%. If you look at employers less than 50 lives, small shops, sub-shops, hair salons, yoga studios, whatever you want to call it, it's pretty much stayed the same. In 2006, we're here. It was 12%. In 2006, we got Romney Care. Since that time, we were at 10%. In Massachusetts, 10% of employers less than 50 lives were self-funded. What's it now? Since we have Obamacare in my state, we have an exchange in place for 7 years. Okay? Anybody want to guess? It was 10% of all employers under 50 people were self-funded. Anyone want to guess what it is now? Nobody? 20. It doubled. So when you look at your company and what your opportunities are for self-funding, if I'm Kempton, or I'm any other administrator, or I'm a free market enterprise, the greatest thing that's ever happened to our industry is the fact that we're competing with exchanges. Because our exchange is a dog. Our exchange is horrible. It gives insurance coverage to everybody. Everyone gets a card. Great, you get a card, but you can't actually get a doctor's appointment. Awesome. So it's like, you know, it's like if I had a Ferrari, okay, and I have this beautiful Ferrari, and it's in my driveway. I got pictures of me, I'm doing selfies on Facebook, I'm twittering, whatever you call it, tweeting. Okay, I'm on Instagram, I'm doing all these things with my Ferrari. I can wax it, I can wash it, I can take pictures of it, I can clean it. I don't have any keys. I don't have any keys. That's our healthcare system in my state. So if you're an employer that actually wants to get new employees, what was the reason why they started employee benefits in the first place? That wasn't brought up yesterday. Anybody know why employee benefits started? Why did they start offering health insurance coverage, employer-based health insurance coverage? World War II, the soldiers came back. They needed to work. Everyone wanted these guys. You had to entice them. How? Give them holidays, give them sick day pay, give them vacation days, give them health care. Big. So in my state, if anything, self-funding has been a boom since we've had Romney Care. And I would assume that a lot of this is going to continue to happen. Yes, ma'am?
What's the floor for self-funding would be the few situations?
I love that question. I was going to ask that question, and I'm going to pick on you now for asking. Why don't you tell me, because I love this question, right? Folks, just so you know, I usually talk to 100% of the people in my audience are insurance professionals, okay? And I make them look like fools all day long. So do not feel foolish if the same happens to you. In your mind, what's your name? I'm sorry. Amanda, great name. What's the perfect size plan for self-funding?
I've never thought about it once in my life.
Just think now.
500.
25 people.
500.
Okay. Guys, I'll never forget this day. I know where I was. I was in Kalamazoo, Michigan, and I asked this question, and a broker raised his hand. I swear to you, I cannot make this up. And I go, what is the perfect size company to be a self-funded plan? The guy looked at me in the face, a broker, and said, $1 million. He said $1 million. Do you have any idea how many employers in this country have 1 million lives? There's like 2. I don't even know. Are there even 2? But that's the perfect size self-funded plan is 1 million lives. I literally bent over and started laughing. I couldn't do anything else. 1 million lives. You think? Like the entire state of Delaware. I don't know. But the point I'm trying to make is the answer, the perfect size, 1. Let me give you an example. Let's say I'm a self-made millionaire. I don't have any employees. I work for myself. I don't even have an assistant. I am the plan. I'm the company. I don't smoke. I don't drink. I'm pretending now, okay? I don't, oh, you drink. I saw you last night. I don't smoke. I don't drink. I run in the mountains every night, okay? I do nothing wrong. I do yoga every single morning. I'm in perfect health, and I have more cash in my wallet than you could ever possibly spend. Why would I have health insurance? Catastrophic. Really? Access. Paying cash, man. First, I want to answer that question. I know that was a good question yesterday. Somebody asked about, direct contract with facilities or providers, the fact that you can go to jail. If you sign up, that's what you've been told, that you can go to jail. I've put a lot of doctors in jail in my career based on that. Because the fact of the matter is, I make deals with facilities every single day. And my entire office makes deals with facilities every single day. But it's important to understand something. One person could be a self-funded plan. The size of the company isn't what's relevant. What's relevant is the demographics of the organization, what their risk factors are. Do they have a lot of data? Do they have a lot of people that are sick? That's really the question. Go to the next slide. Okay, so we're going to talk really closely about a couple of things about the market factors, the surge of self-funding. And I want you to look at only the second tab. Will exchanges succeed or fail? Employee access to care. I want to focus on that first. It's my opinion that the only way the free market system will work, this is just me, okay? And I do a lot of blogging, so people disagree with me all the time, and that's fine, okay? We need the exchanges to work a little. They need to. And the reason why they need to work a little is if they don't work, what's going to happen is, look at the bottom. Adverse selection and the NAIC. The NAIC is the National Association of Insurance Commissioners. These are the insurance commissioners in each state that control Blue Cross, United, Cigna, Aetna, stop loss, the able to purchase stop loss coverage. They control it all. Right now, the National Association of Insurance Commissioners is petrified of self-funded plans. They are afraid of me, not me, but companies like myself. And the reason why they're afraid is they cannot control our organizations because we are exempt from state law. We are under ERISA, okay? So unless, and I was in the U.S. Supreme Court, Supreme Court Justice Sotomayor actually said, during one of the cases that I was involved with, she actually said when I was sitting there, so the only way to get rid of ERISA is an act of Congress. Yes, that's the only way you'd be able to get rid of ERISA. If you've looked at our Congress recently, nothing is getting eradicated anytime soon. There is not going to be any eradication of ERISA, okay? What is going to happen, though, is there's one very simple, easy way to destroy self-funding as it exists right now. Very easy. Anybody want to take a shot at it? Stop loss. My company purchases stop loss at $50,000 specific deductible. So any of my employees get sick, after $50,000 of my payment, I have a liability policy that reimburses. Those policies, stop loss policies with Sun Life, HM, Symetra, you name it, there's hundreds of them. Those policies are governed by state law. It's not ERISA. If I'm no longer able to purchase that policy, guess what happens to me? I'm not self-funded anymore. There's no way I'm self-funded because I can't afford to take a chance that a catastrophic claim comes in for $1 million for one of my employees and I have to come up with $950,000. I'm out. I'm out of business. I am going to do what? What am I going to do? I'm going to go to the exchange or I'm going to purchase a fully insured plan. That's it. It's very simple. And I've been preaching this for years now. And people a lot of times say, oh yeah, you're full of it. Nothing's going to happen. Trust me, they wrote the white paper. And I was involved with SIA, which is the Self-Insured Institute of America. It's our national association. It's one of like 4 national associations. And we did a response. And if you listen, if you read the white paper, by the way, anyone wants any of this stuff, you can email me. I'll give it all to you. The white paper makes a scene. And I'm going to pick on a table here. All right, you guys, okay? Healthy, young, yoga studio. That's you guys. I can just see it right now. You guys are all working out. The down dog. I can see you doing that. You know, you're the yoga studio. You got 75 lives in your plan. You got stop loss at $50,000. Your healthy lives. You guys, man, the truckers union. You guys are on meth. You guys got some crystal on your pockets right now. I see some heroin marks. I see everything going on this table. This table is just really fun, right? These guys, maybe you don't want to mess them on a Friday night because they got knives. You know, who knows what they got on them. But this plan is in the exchange, folks. Why? Because they can't even think about being a self-funded plan because way too much catastrophe ongoing here. Way too many drugs, way too many big claims. This guy's got diabetes. This guy's got heart problems. Bad. What are they doing? They're going to the exchange. The exchanges will fail in every single state if all they have in the exchange are these guys. Bye-bye. Exchanges are over. They need them. They need healthy lives. Yoga studio, young people, the IT firm where everyone, drinks, decaf coffee. They need good plans in the exchange in order for the exchanges to succeed. Why in the world would they decide to join the exchange when they could self-fund if they could purchase stop loss at a decent amount of money? But do you know what the NAIC white paper says? It says the reason why your yoga studio has decided to be self-funded is to avert Obamacare. You don't want to be part of Obamacare. You're trying to avert government regulation. You don't want to offer health benefits to your employees. You don't want them to have unlimited health care coverage. You don't want them to have pre-existing condition coverage. It's all lies. The Department of Labor came out with a report 2 years ago that specifically stated that a self-funded plan versus a fully insured plan, in regards to paying claims, there's no difference. They're just as willing to pay a claim as a fully insured plan. If anything, they have more reason to pay a claim. Why? Because they're your workers. You need them working. You need them not to be sick to make money for your company. But guess what? If they can't purchase stop loss, they're joining these guys. And so are you, and so are you, and so are you. And that's why I said at the beginning, we need the exchanges to work a little bit. Because if you look at different states, Connecticut, there was a group of physicians in Connecticut that wanted to create their own plan to be part of the Connecticut exchange. And they weren't getting any traction. They weren't getting any lives. No one wanted to join their particular plan. They're like, how do we get more plans? Well, they happen to know the insurance commissioner for the state of Connecticut. So what do they say? Hey, listen, let's try to limit the availability of stop loss. Limiting the availability of stop loss for organizations will force them to either be in the exchange in that particular state or be fully insured, meaning they're now under the governance of that insurance commissioner. This white paper just came out. So I really would request that you look at this to realize that, to me, is the biggest threat to Kempton, to my organization, to any self-funded plan, to any free market thinker who wants to try to do some of these things, to realize the opposition's there. They don't want us to succeed, which you would think is the opposite of what the American dream is, that you find an innovative way to reduce the cost of claims, that people would embrace it instead of trying to put it down. And that's exactly what's happening now. Next slide, please. Okay. The 2 biggest things I want you to focus on, the rest of the stuff, feel free to read when if you want to read it now, it's fine, but I'm not going to talk about them. The 2 biggest benefits of self-funding, 1, access to data, and 2, benefit design. Really simple. Access to data. Why is that important? By having access to your own claims data, you can run analytics to see where your risks are. You can see, maybe we have a really big problem with heart disease. We have a really big problem with high blood pressure. We have a lot of smokers in our office. Maybe we should start a smoke cessation program. Whatever it is, the data allows you to basically figure out what your risks are. Really good TPAs out there even have people, actuaries, who work at their facilities. I know that Entrust has an actuary that works at their office specifically to look at risk, to tell you what your risks are. I know a lot of companies do. If you look at Kempton, they look at their claims data all the time. You have to look at your data. That's the benefit of being a TPA versus being self-funded with a ASO, a Blue Cross, a United, is with Kempton, you actually get to see the claims. Amazing. You can actually look at them. I look at our claim data on a monthly basis, obviously without PHI. People ask, oh, so you look at your people's health? No, there's no names. It's just the diagnosis codes and what they're charging and what the costs are. I can tell you just as good as any other company, because of all the data that we've collected over the years, how much every single facility in the country charges for every single procedure. I can tell you anything. You pick a diagnosis code for me, I'll run it by my office, I'll put in the system, and I'll tell you exactly what's being charged by BUCAs, what's being charged by every single network, what's being charged by Medicare, what's being charged by self-pay, what's being paid by out-of-network claims. Easy. The data's there. Who wants it? Nobody. Why? It's the most simple thing you could do. By having access to data, you can figure out and customize your plan design. Why is that important to customize your plan design? Here's why. Let's go back to the yoga guys and the drunks and the drug users, okay? We got these guys here, bad plan. These guys, perfect plan. Do you realize in Blue Cross, and I'm sorry if I'm picking on Blue Cross, I usually say BUCA, but Blue Cross just makes sense just to keep it simple, okay? The plan design for these two companies is exactly the same. In Oklahoma, in Massachusetts, the difference is bronze, silver, gold, platinum, glitter, okay? That's the difference. You pay a different copay, deductible, that's it. They have different needs than your plan does, okay? Let me give you an example. And again, it's a personal story, so I apologize for anyone that I might offend, okay? I had a best friend. I say had because he's died. At age 20, he had a really bad car accident. Horrible, horrific car accident. And he was prescribed Percocets and OxyContin, okay? And anyone in this room that doesn't know someone that has a drug problem, you're lying to yourself, okay? It's everywhere. He was prescribed these things by a doctor. So what happened? He's at home, his back's messed up, he can't work, he can't even play basketball, he can't do anything. He's sitting in front of a TV, watching TV, and what's he doing all day? He's popping pills. And then when his prescription runs out, you think that miraculously he's just gonna stop wanting Percocets and OxyContin because he doesn't have a prescription from a doctor. That's crazy. So what did he do? He bought it. Where? On the street. How much? $25 a pill. Okay? And then what do you start doing when you don't have $25? You start robbing from your mother. You start taking money from your dad. You start taking money from your best friend. I go hiking with them, my money's gone. Okay? And then you realize the same guy that's selling you Oxy, he says to you what? Hey, listen, for $25, you're paying for OxyContin. I can give you heroin for $5. It's the same hit, if not better. And it's 5 times less money. So then he starts doing heroin. And then he gets addicted to heroin, and then he overdoses and dies in the projects in Southie 2 miles away from my house. That wasn't from smoking weed. Okay? So I tell people this because there's alternatives in your plan design in how to do things. You cover acupuncture. Why? My mother has MS. If you're a doctor in here, you know exactly what I'm going through. She has MS. She won't take a pill. My mother is a first-generation woman from Poland. I'm not taking drugs. I'm not going to change the way I am. She worked 3 jobs to raise me. I'm not going to allow my psyche. I don't want to be in cloud 9. I want to be fully aware of everything. So she goes to an acupuncturist. Now, whether or not you think acupuncture works, whether or not it actually does anything, in her mind, it does. And that's really, at the end of the day, all that matters. So we have acupuncture on our plan free. No copay. No deductible. You want to go see an acupuncturist? You want to pay cash? Bring the receipt. We'll reimburse you. Simple little things like that. And this is nothing. This is basic stuff. But little things like that that you can put into your plan design that can make and break a change to one person's life forever in that particular plan. And these are the kind of things that you need to look at and the kind of things you need to do. Go to the next slide if you don't mind. Okay. The reason I bring all this up, it all matters about one thing. I talked about fiduciary duty. The actual ability to make the decision. Now, in most self-funded plans, if you're not working with Kempton, you don't have control. If you're with Blue Cross, United, Cigna, Aetna, here's how it works with self-funded, okay? Mike, Todd, sorry. I didn't realize you have to put both names there. You couldn't just get rid of the Michael, so I would just said Todd. Oh, it's more important. Okay. Todd, very simple question. Okay, Todd, let's make it easy. This is the deal you have with a self-funded plan when it comes to an ASO, Blue Cross, United, Cigna, Aetna. I'm going to spend your money. Okay, this is your money, and your employees' money. I'm going to spend it. I decide whether or not to spend it. I decide how much I'm going to pay. I decide when I'm going to pay. How's that sound? He doesn't like that. That's the reality of self-funding. But you have great discounts. I'm in bed with these organizations that I'm going to pay. I'm going to spend your money any way I choose. Most plans that are self-funded, that's the model. It's the model. That's the way it works for most self-funded plans that are not working with a third-party administrator. That's why when I talk to brokers all the time, I'm like, listen, brokers, you're working with ASOs, you're working with Blue Cross, United, Cigna, Aetna. You're not working with the TPA. You cannot control how your client's money is spent. You want to look like a Superman? You want to look like a hero? Gain that control back. So you can have a direct contract with a facility. So you can start doing some of the things. You could even put acupuncture in your plan if you wanted to, just to have it, because you don't have that particular control. So it's very important that you realize that fiduciary duty piece. Most employers, though, the first time they're self-funded, are totally afraid to be a fiduciary. They've never had control of their benefits. So what happens is they're fully insured. They pay a premium every month. Now they're self-funded for the first time. I could see where they'd be a little nervous about having the claim decision because they've never had it before. And I can tell you what an HR department will say. It's very simple. We don't want to deny claims. We don't want the employees being mad at us. But it's okay if the claims are denied or they're paying way too much by Blue Cross, there's someone else making that claim decision. And that's how they're looking at it. Go to the next slide. Okay, so who are the players? We talked about self-funding with a TPA being very different than self-funding with a BUCA, Blue Cross, United, Cigna, Aetna, okay? So focus on the bottom. No control. It's very important you understand that. If you're working right now with an ASO, you're working with the BUCA, and you want to do some of the things that have been discussed earlier today and will be discussed tomorrow, just leave. You can't. None of this stuff is possible if you're trying to work with those organizations. But it's starting to change. So when I say none of it, take it with a grain of salt. But at the end of the day, much more control working with the TPA, much more control being in a self-funded environment. Next slide. This is a very important slide for you to look at. I know last night Dr. Smith talked about Medicare Plus pricing and how he's against it, and I share his views, but I'm going to share with you what's happening right now in our industry. You basically have two worlds right now. You have the one world where it's pure network affiliation, pure BUCA affiliation, whether it's MultiPlan or Cigna or Aetna. It's all networks. Those people over there. Nice and easy, safe. If you're an employee, all you see, my copay, my deductible, that's it. No noise, no goodwill issues. You're the employer, your employees have access to every doctor in the world with an amazing 10% discount on many of them, right? Awesome. But they have a great discount. No, they haven't. A lot of times it's a really good discount. It's like 70% off of $3 million. It's awesome. So they have that security. And then now what you have is what's called reference-based pricing, RBP, where everything is out of network. That's these people here. There is no network at all. There's nothing. Every single claim is the Wild West. Every claim is gunslinging. Well, that's Oklahoma State, right? They do that, right? I watch college. I am the one guy in Boston that does Texas Tech, is it?
OSU, they steer from each other.
Oh, okay. If I cross the border, it's Texas Tech. Okay, I like it. Very interesting. Okay. Anyways, no, I actually do like college. I'm like the only guy I think that watches college football in Massachusetts, by the way. I don't think anybody else does. And we have BC and UMass. Woohoo! Anyways, this is out of network. There is no network. Every claim is a crapshoot. Every claim you're playing, you're rolling the dice. You have no idea if what you're sending is going to be accepted. The plan has a document that says, I'm going to pay Medicare plus 30%. Great. Travis, you go to the facility, you have your services done, you leave, the plan pays Medicare plus 30%. Let's pray. Let's see if it works. Let's see if it sticks. Let's make sure, let's see if they don't balance bill you. That's happening a lot. In my office right now, I personally, with my small team of 3 people, have 5,000 of these claims. 5,000 claims where the plan paid the money, the facility, for whatever reason, didn't accept that amount, and now they're balance billing the patient for, I don't get hired for a $10,000 balance bill. I get hired for a $100,000 balance bill. I'm talking about people that have $400,000 being balance billed to them, and their husband just died, and they own one little house, and they're crying on the phone. That's my world, okay? That's not your world. That's the world I live in every single day. That's pure out-of-network. There's good, but there's also a lot of bad because there is no deal. There is no facility, let's make a handshake deal on a lot of these claims. So this is what exists in our industry today. And the proponents who are against all this free market stuff, what they're using to try to keep as many of their clients in that clean, happy, little house on the prairie world over here, is they're bringing up the most egregious examples here. Poor Travis got balance billed $700,000. You want that for your employees, or do you want to have the safe comfort of a $5 copay? It's hard to argue that, but there is an opportunity. Next slide, please. So this is PPOs in the reality of the world, okay? Yesterday, I know Corey mentioned Multiplan. Multiplan and I are not on best of terms. I don't care. Like I said, I'm a kid from the hood, okay? I grew up in the inner city. I do not care. The fact that I'm in Oklahoma City speaking to all you people, to me, is a very humbling thing. Anyone that knows me for a long time knows that I know where I came from. I respect what I have now, and I am not going to change the way I'm going to act and the way I'm going to behave and the way I'm going to prosper and move forward anymore. I don't care that Multiplan is a $6 billion organization because I know their contracts inside and out, and I know every hole in their contract. And the bottom line is there's a lot of stuff that you can do when it comes to networks. But they are the biggest bullies. When I get a response back from a network as to, I have a claim of $800,000 and there's a 50% discount, and it's $400,000 that they're asking my client to pay. And I'd say to them, can you justify to me where you got this number? Because based on all the data I have, remember, it's a negotiation, you need data. Based on all the data I have, I don't see why you should be getting over $100,000. You know what their answer is? Read the contract. You agreed to a 50% discount. You agreed not to question the bill. You agreed not to audit the bill. You agreed not to say anything but pay me within 30 days. 4 corners of the contract. Claim comes in, it's clean, you pay it within 30 days, no questions asked. It's North Korea. Literally, if you're out of line, this is what they say. I'm not making this up. If you don't agree to that, we are going to what? Kick you out. That's it. That's the answer. We're going to kick you out and all the other plans. So if you have a good TPA like a Kempton that comes in and is trying to save money for your plan, and you're working with one of these organizations, these networks, and you're questioning a bill, you will get a cease and desist letter, and they're going to tell you, not only are we going to kick you out of the plan for this one employer, we're going to kick you out for all of your employers. Now you're Jay Kempton. You built this business. Your dad built this business. You're now you've taken over the family name. This is your company. You're going to lose access to your network because you questioned the bill? This is the reality, folks. There is no answer of, here's how we came up with $800,000. We did this and we did that, and this had a lot of complications, and this surgery took longer than we expected. It's literally, shut up. That's it. And the fact is, when you sign these contracts, and almost every employer does, the judge in a courtroom is going to look at the contract, and the judge is, it doesn't matter how they feel personally. They look at the contract. They look at the contract and go, sir, you agreed here that if they give you a discount, you're going to pay it within 30 days, and you're not going to audit the claim, and you're not going to question the bill. So you lose. You agreed to it. It doesn't matter. And that is the ultimate problem that we have in our industry today, is that I think a PPO, when they first started them, there was good intentions. I could see the reality. I could see why they came up with it. But here's the problem with a network, even a narrow network. Everything starts off small. Okay, so I got, let's say, again, I don't know this area, but let's just use Boston, okay? There's 20 hospitals, but let's just say there's 5. And I start my company and I go, hey, Hospital Allison, I want you as part of my network. I'm going to steer patients to you, steerage. I'm going to give you patients, and in return, you're going to give me good discounts. Great. Now, I have you. But the next client I'm trying to pick up says, yeah, but not only Allison, I need Jamie Hospital. A lot of my employees want to go to Jamie Hospital, so can you get Jamie Hospital in your network? Sure, Jamie Hospital. I'm going to give you, let's make a deal, I'm going to steer people to you as well. I can't give the same discount as I got her because I can't give you as many people, but let's do a 30% discount. Then what happens? The next client wants the next hospital. The next client wants the next one. Pretty soon, every hospital is in your network. How can you steer anyone to anything? You can't. So all those discounts go away. And that's...
They're still there. They're just not true value.
Exactly. They're there. But when I say discounts, I mean like real discounts, something that makes sense. All that's gone. And the point is, that's part of the problem, is that these organizations just get too big. So we're seeing the harsh realities of it. Next slide, if you don't mind. Here's actual language, folks, okay? I'm going to read it to you, right? In no event shall the client, this is the plan, okay? When I say client, every time I say client, it's the employer plan, okay? Shall audit or reduce the contract provider's bill charges based on usual and customary, excessive markup, other similar reduction methodologies. Client acknowledges that a contract provider may refuse to honor the contract rate if client reimburses the contract provider based on a UNC reduction. What does it mean? Based on the plan, whatever we want to charge you, you're going to pay. This is typical. Very, very typical language that we see. I use this language, though. Are there any networks here? Good. I didn't think so, huh? Yeah, better not be. But the point is, I use this language in a positive way. Let me tell you how I flip this. Okay? So you said to me, the provider may refuse to honor the contract rate. So the provider is agreeing the contract rate doesn't apply. You're agreeing that this contract is garbage. So now it's out of network. Let's have some fun, baby. Now you're telling me that there is no contract, there is no deal, so now you have to work out a deal with me. Now it's free market. Now you have to make a deal with me. Now we can look at the charges, now we can audit the claim. You're telling me the contract doesn't apply anymore? That's what I want. And that's the way I get around a lot of these things. But again, you get the cease and desist letter. You get the, I'm going to take you to court. And that's what scares a lot of employers. They don't want to go to court. I can see that. Next slide, if you don't mind. No audit provision. This one's great. Payers shall not retroactively review pre-authorized claims, pre-authorized services. So basically what they're saying is pre-certification is a guarantee of benefits. You're not allowed to review it afterwards. Every single plan document should specifically have language in regards to this. But again, this takes away all audit rights. You don't have the right to audit anything. You get your discount, that's it. No questions asked. Next slide, if you don't mind. Assignment of benefits, let's just skip this. I don't want to go over your heads. This is a little bit legalese, if you don't mind. Okay, next one. Good. Out of network, we talked about it. All the providers are fair game. There is no network. Every single claim you can negotiate, no question about it. But the problem very much is this: noise. The balance billing is big. There is people, I love when I hear companies tell me there is, oh, with our program, there's no balance billing. That's crazy. You can never stop someone from filing a claim against you. Right now, if somebody wanted to, back in Boston, they could say that I have broken into a store and filed a claim against me at the police department, and then when I land at Logan, I'll have a warrant for my arrest. And then I'll have to prove by calling Dr. Smith and say, hey, we tell them that I was in Oklahoma City this morning doing a speech. Right? I can't stop someone from filing a claim. I can defend it, but I can't stop them from filing it. And that is right now is the answer on all this. I can always try to negotiate, but I never, ever 100% can stop you as a provider from going after that employee and trying to ruin their credit. The number one question I hear from members is, I'm trying to refinance my house. I can't refinance now because they ding my credit score. Or the hospital placed a lien on me. It's not easy to get rid of that stuff. It takes work. It takes time. Anybody ever here had their identity stolen or someone steal their credit card and your credit score gets messed up? Imagine having to do that 3,000 times. This is the gimmick. Again, it's not always hospital's fault. Reason being, a hospital has their collections agency, the collections company within the organization, the billing department, but then they outsource it to a collections agency. So even when I tell the hospital to stop balance billing and you agree, by the time you and I agreed, it's already gone to the collection agency, and the collection agency is doing their own thing. And they don't have the same agreement as they do. And they're vultures, much different worlds with the collection agencies than it is dealing with the hospital. So once it gets to the collection agency, it gets much tougher. So there is the pros and the cons, but again, this is a lot of work that employers need to do. Next slide. And here's the thing. This is where I come in. My life is here. My life is everything in the middle. I don't necessarily believe I definitely don't think you should have all claims in network, and I don't think you should have everything out of network. But the problem with our industry, folks, is most of the people that I work with in my industry, they're taking advantage of the current system, okay? Now, let me give you an example. There are firms out there right now that charge a percentage of savings. So if a claim is out of network and it's $100,000 and they get that claim paid at $10,000, they saved you 90 grand. They want to charge you a percentage of savings on that 90 grand. This is my industry. These are my cohorts, okay? What they should be doing the minute you took $10,000 as full and final payment, they should have a one-page document going to you saying, hey, let's make a deal on all future claims. We just made a deal on this one. Let's work out a deal for the rest of the claims that I ever have with your facility and some kind of number. Let's figure something out. But why would my cohorts do that? They have no reason to. They want every claim to keep getting negotiated because they get paid 20, 25, 30% of whatever they save. Having that one-time contract, direct contract with the facility, doesn't make them any money.
The higher the bill, the easier it is to negotiate.
Exactly. And the point is, they'll tell you, the bills keep going up. They want the bills to keep going up. The higher the bills go, the better off they are when they're negotiating the deal because they make more money. What you want to identify is companies that say, hey, not only we negotiate that claim, but let's see if we can work out a deal going forward. A direct provider contract. Why I'm here. Free market. Really making deals with people. And that's exactly what we do. This is all the stuff in the middle. Medical tourism. Can someone here tell me what medical tourism is? Love this. Go ahead. Go ahead.
Can you go somewhere else for not
Where?
anywhere?
Oh, come on. Damn, Amanda, I didn't want that answer. I wanted you to tell me like Costa Rica. Man.
Right here, Oklahoma City.
It is. For my plan, Oklahoma City's medical tourism. They go to Dr. Smith. They go to Oklahoma Surgery Center. We have his prices online. And I'm going to be very honest with you, okay? If you know me, you realize I just say it like how I feel, okay? Dr. Smith's prices are not cheaper for every service. I have my data. I look at my facilities in my area, okay? So I'm just being very truthful. But I at least can look. He charges $8,000 for this. Our hospital that we use locally charges $9,000. But it's not worth the flight, the airfare, and all that. Okay, we're going to keep it local. But tell me this. You hear about transparency. I love that word. It's my favorite word. Transparency, okay? I speak to rooms of insurance people all day long, and I talk about transparency. And I ask people to raise their hand. How many times you've gone on, again, I know there's certain people in this room who do this. Please don't raise your hand, all right? I know who you are. I ask insurers, people in the insurance world, raise your hand if you've actually gone on a CMS website or any website and compared pricing for two facilities to see what a knee replacement would cost here versus here. Nobody. But yet, you expect employees, the truckers, your daughter needs to have surgery. You're going to look at 5 different hospitals. You're going to go online. You're going to compare all the pricing, right? You're going to do all that at the truck stop. You're going to compare on your little iPad. Oh, man, oh, wow. And then you look at okay. And then you're going to make the decision that way. It doesn't exist, folks. This is fantasy world. It's Fantasy Island, right, with Tattoo, whatever his name was. It doesn't exist. You have the people that are in the insurance business don't do it, but you expect him to do it? So how do you get people to do it? It's right there on the screen. Who said what? Skin in the game. Money. Cash. Cashola. It's the key. Every single thing in my plan is designed that if you save money for me, you're making money too. My employees look at every single bill inside and out. They go crazy on these bills. They love the bills. My Uncle Derek is married to my Aunt Denise. My Aunt Denise works at FIA. She literally talks all day long. She doesn't get much work done, and the worst part is she talks to all the people around her so they don't work either, okay? And she smokes, so she wants to go on a smoke break. She can't go alone. How could she smoke by herself? Heaven forbid. So she's got to take some with her, and when that person is a little bit behind, and she's almost done with her cigarette, but they're just starting their first one, she's obviously going to start a second one so that she can be with them when they're finished their cigarette too. She's awesome. My Uncle Derek is her husband. He's on my plan. It's my mother's brother. My Uncle Derek is 50 years old. He plays in a lot of basketball leagues. You know, he's one of those guys, like 5 different knee surgeries. So he does 5Ks. He literally runs like this. You know? It's like, I'm like, you're not running anything, man. This is, I mean, literally people are gliding by him. Like people with strollers are flying by him. But he always needs surgeries. He checks out your prices. When he knows the surgery he needs to get, he knows what it costs at Boston Medical Center, and he looks at Dr. Smith's price to see, is it worth for me to get 20% back? Up to $10,000 he gets if we find any facility, whether it's Dr. Smith or any other provider we have a direct contract with, if the amount of money the plan can save, the differential, whatever that is, $20,000, $30,000, $40,000, you get a percentage of it back in your pocket to do whatever you want with. Trust me, you're going online. You're looking at the bills. No question about it. But all these things in the middle here are stuff that you can do. So we talk about carve-outs, dialysis. Davita and Fresenius are the 2 examples I want to focus on. For 30 months, they can charge you basically whatever they want. I have a couple slides I'm going to show you in a couple seconds to talk about it. RX, prescription claims. Biggest ripoff right now going on. This is the highest growing area where there's potential for a serious, serious savings. You talk about the network contracts are bad. The PBM contracts, the rebates, you think those rebates actually ever get back to the plan? Never. I don't think I've ever seen one go back to the plan. Next slide, if you don't mind. But the point of what I was trying to say is there's a lot of stuff in the middle that you can do, and we're going to cover those in the couple seconds that I have left. Hidden costs of drugs through your plan design. Major prescription drug problem. We've seen it. There's no question about it. The next slide is going to talk about specifically how much we're talking. You need to manage, if nothing else, you need to manage your specialty drugs. Because the specialty drug market, as all of you know, is big money. And now the stop-loss carriers are finally realizing you need to look at these high-cost specialty drugs in order to reduce the cost of these particular claims because they're killing a lot of plans. Next slide. $300 billion in avoidable costs due to medication and adherence-related problems. 20% of all employers' spend is just on pharmacy benefits, and 20 to 40% of those pharmacy benefits are only specialty. This is big money, big racket going on, and no one is auditing this stuff. Nobody. There's huge potential here, and we're working with companies that are doing some really serious stuff to lay over existing PBMs, or at least audit them. Just question it. No one even questions these guys. Next slide. So what can you do? You actually have audit rights in the pharmacy networks to audit the bill, renegotiate the actual charges, renegotiate the actual contracts, and have a right to terminate if you're not happy with the way things are going. There's no question this is a big area that needs to be resolved. Next slide. Here's what I was talking about. And every time I say this slide, I have brokers that just look at me. Read the first one. Our audit review program. Every single plan in the country should, your health plan should have this in your plan. Take, copy and paste it, I won't care. Take it. Put this in your plan, it's going to save you a lot of money. The audit review program is designed to reward employees for identifying and recovering erroneous charges on bills for medical service supplies. This is our actual language. If you identify something, you're rewarded 20% of the recovered amount up to $10,000 maximum. It's in our plan. It's in the employee handbook. You, Todd, your wife and your kids, you're sitting around the kitchen table with highlighters and crayons, and you're looking at every single thing. You are. The #1 auditor, people, oh, we have the best audit firms in the country. We use the diagnostics and we use the algorithms. Yeah, you got a guy in India running a program that's identifying overpayments. Okay. How about Todd, what's your wife's name? Mandy, kids? Aubrey. Let them sit around the table and look at their own charges. 20% back. We find this all the time. Next slide. Look at this. This is real. While on vacation, our employees sought treatment out of network emergency room, admitted for observation. They charged them for 2-day stay, but they were actually there for less than a day. They got there after midnight, discharged the same day. Fee at the plan saved $10,000. We gave the employee a check of $2,000. Done. Who's going to find that? You're not going to. No audit firm is going to call the employee. Oh, how long were you there? No, that doesn't even exist. This is simple stuff that every single plan can put into, and you can use it on small claims, large claims. You can use it on network charges. I don't care, even if you have a network, you can do this. We have access to Blue Cross Blue Shield Massachusetts in our plan, and we have all these things. Because this doesn't upset the providers. This is literally our employees identifying ways to reduce the costs. It doesn't hurt anybody. It actually helps the plan. It helps the employees. And the first thing, like I talked about before, the first thing we need to be able to do in order to get this whole free market movement going is to get buy-in from the employees and the employers. And that's going to be through their brokers. When I bring this up to brokers, every single broker, go to the slide before, the one I just did. Every single broker asks me for this slide. All of them. So the same guy that says, nonsense, I need networks. Why? They give me awesome discounts. There are brokers that no matter what you say, they live on the discount dream. You give them 60% off, and you only do they look at that, and that's it. That's tunnel vision. They've been in the business for 30 years. You're not going to change them. But they all add this. And if they're adding this, it's at least getting the employer to realize you can look at the bill, which we talked about yesterday, and Dr. Smith, you talked about it last night. People don't look at the bill. So that's the fundamental problem. This right here gets them looking. No matter what, they're looking. So if you can get them to look, it can start the movement. It can start the change. So this is something that we put in all plans. Next slide. Go to the next one after that. Okay. This one's a great one too. Check this out. Utilization of said provider services will not result in a deductible or copay for the covered services received at said provider's facilities. Okay? What we're doing is, in English, no copay, no deductible. Direct contracts. Direct contracts. We want steerage. We're trying to go back to the old PPO. Hey, great, you got this network, but if you go to this facility or you go to this specialist that we have a direct deal with, no copay, no deductible. Again, bottom line pocket. Let me give you an example. I am not a doctor. I wish I could have been one, to be honest with you, because I just can't stand blood. It freaks me out. So I went the lawyer route instead, right? Lawyer, doctor, same thing. Anyways, actually, I mean, come on, what you guys do is so much more important than what I do. I recognize that. But the key thing here is, our employees right now, they can go to Brockton Hospital, which is 10 miles away, and pay $250 for an emergency room visit. So when their kid needs stitches, or their kid has a broken finger, or they hurt their ankle playing soccer, they go to the emergency room, pay $250. There's an urgent care facility called Doctors Express that I'm friends with the doctor who owns 5 of them. They deal with the same stuff. They can fix every single one of those things that Brockton Hospital can fix. The guy's a great doctor. He's a great friend of mine. Go there, there's no copay. Wait in the emergency room for 2 hours, pay $250. Wait 5 minutes, go to the urgent care center, no copay. I don't know. Which one am I going to pick? The employee now has skin in the game. This is what it's all about. It's starting at the grassroots level, and it started with our employees. Every single thing that we're doing here today, we do at our office. Next slide, if you don't mind. Okay? See it in action. This is the dialysis case. This is normal. You asked me for an example. Okay, this is the biggest scam on earth. Go online. Feel free to play with your iPads. Go on davita.com. Go on fresenius.com. Look at their 10Ks. I have a master's degree in finance. I know stocks. Okay? I know how to analyze stock. They, in their 10Ks, promote the fact, in my words, of we can rip off every employer for 30 months on in-network charges before, after 30 months, as you guys know, end-stage renal disease is paid at Medicare. But for 30 months, we can get them. There you go. Plan analysis. $55,000 per month we're able to save by carving out dialysis to a price that we're willing to pay. Some clients, because it's dialysis and it's end-stage renal disease, they want to do it at connected it to Medicare. Is a good example. I can tell you that I'm friends with the lawyer, national lawyer, who represents DaVita nationwide. Nationwide. If the plan document has language in it limiting dialysis to Medicare plus 30 or whatever it is, whatever, or a number, cost, some kind of number, okay. That's it. He doesn't fight it. He doesn't fight it. We're talking about $55,000 a month for almost 3 years for one patient that can be saved for a plan. Do you know how much money it costs if you hired me to put that language in the plan? $600? Not thousand. $600. I just saved you $55,000. I should start charging percentage of savings, I think, huh? But the point is, this is every day I see these. This is not once in a while. This is all the time. You all know dialysis. There's a lot of people on dialysis. This is serious stuff. Serious money that can be saved where you have a direct relationship. How about dialysis at home? Work out a deal with some organization. Figure it out. But we're talking about, on average, $80,000 a month people are paying. $60,000 to $80,000 a month they're paying for dialysis treatment in a network that gives you an awesome 40% discount. What? It's crazy. In my mind, you know what? I'm always scaring people. I tell people, the brokers, you're a fiduciary. You have a duty to your clients to protect them, to protect their money. The fact that a union member hasn't sued his union plan for a breach of fiduciary duty, I'm waiting for that day. That's a law firm, that's a national lawsuit that I'd love to be part of. Because you're putting union money, your dues, your personal money into a plan. The plan has a duty to protect plan assets, and you're dispersing those funds in any way you want. You're overspending on dialysis by $55,000 a month on average per patient. It's crazy. So again, you got to make sure that if you try to do these things, that you're allowed to do them based on the contract that you signed with the particular network ahead of time. Next slide, if you don't mind. Really simple. In the plan design, I'm not going to spend my time going over these things. Just want you to understand something. These are the areas that you should put into your plan design, which will allow you to have the ability to audit claims, to incentivize employees, to give them cash back, to give them skin in the game, to make people look at the charges, and to then make people want to do a contract with Dr. Smith. Without having language in the plan doc, nothing can happen. So one of the examples I want to focus on is literally clean claim. Define it. What is it? 90% of plans don't even define what a clean claim is. So you send in a HIC for a UB, it's clean. Okay? You don't have any right to ask any questions. No right to see if there's coordination of benefits. Was it a car accident? The State Farm is responsible for this claim, or whatever the situation is. Are there subrogation opportunities? Nothing. You got to have the right language within your plan. Last slide. This is me. I'm Adam Russo. I have, every single month we do webinars. On average, 800 different people sign in to our webinars. I didn't realize that Kempton has 10 people listening on that one registrant. So on average, we have 800 people a month that listen in. It talks about everything from healthcare reform to compliance issues to exchanges to skinny plans, minimal essential coverage plans. You name it, if it has to do with ways to save money for the employer-based healthcare system to thrive, we talk about it. It's on a monthly basis. I also have a blog on the bottom right-hand side called passionforsubro.com. Everything and anything you'd ever want to know about self-insurance is on there. So if you want to look cool tonight when you're going out to a bar and it's Saturday night and you want to read up about self-insurance, go on that blog, read about it. My name's Adam. I guess I have a couple minutes for questions, right? Anybody have a question? Yes, sir.
Back to the Obamacare exchange you were talking about. You wanted to be a little successful to drive things towards what you're talking about.
Right.
With the reinsurance program and the risk corridors that are in place now being temporary, when those go away, how do you see that affecting this?
I don't know. And that's one of the things I want to bring up is I really don't know the answer to that because of it's as a government program. Being in the world that I'm in, where we literally have 3 people in our office that do nothing but talk to the Department of Labor on a daily basis. That's all we do. Because there are so many questions that they don't know the answers to. We will literally ask them a question, and they'll say to us, we don't know. Do your best. That's the answer we get. So I know that Corey talked about, for example, SBCs yesterday. The biggest waste of taxpayer money that I've ever seen, the only people that make money on SBCs is me. I have to write them. It's horrible. It's a waste of time. But from a standpoint of when you look at all the mandates that have come in every single year from they get delayed, I don't know what the answer to that question is, how it's going to affect it. All I know is when I look at the direct market effect of what can really affect how self-funding moves forward, to me is with the reinsurance stuff, and the risk corridors, I think there's ways to work around those particular ideals, specific when it comes to the government. But when it comes to the actual access to be able to purchase stop-loss coverage, that to me is just something that is just so overtly obvious and scary. It's the number one thing I focus on. Yes, sir?
You mentioned DaVita Labs several times. I know that they also...
DaVita, excuse me?
DaVita, the
Yes,
dialysis. They also bought a group called, or own a group called Paladina, which supposedly has around 35 direct primary care practices, and I haven't been able to find much data on them at all. Do you know if that's a bad guy, good guy?
I don't know.
Any
I'm
experience with
assuming if it's owned by DaVita, there's no way it's going to be anything good.
them? Yeah.
That's just my take on it. And again, they're growing. These organizations are growing. They're not getting smaller. They're buying up. And Fresenius and DaVita do not like each other. I mean, it's open and obvious that they don't like each other. There's a lot of problems with those facilities. But again, in some areas, I mean, where I'm lucky enough to be in an area of the country where you can basically find a specialist for anything at any time. Right? I mean, Harvard's there. I mean, there's so many opportunities. But we work with a lot like Baylor. Baylor in Texas. I hate the Baylor Bear football team just because I hate the hospital. I don't even know. I've never been there. But Waco, to me, has got to be the hellhole. Like, I hate Waco, Texas, just because Baylor's there. I mean, what they do is so egregious because they can. And with all due respect, if anyone's from Texas here, you take Baylor and stick it in Boston, they're not Baylor anymore, okay? You take them out of where they are and the fact that they're the big bully in Texas, they have the best doctors, the best specialists, no one can touch them in their area, and you take them and put them in Boston and let them compete against my hospitals, and let's see if they're so egregious, and let's see if they're such bullies. They're taking advantage of the fact of where they are. That's it. And the problem that I have is we have a lot of clients in areas where literally there's facilities in Wichita that are charging 5 times more for the same exact care as someplace in downtown LA. How? How does that even happen? The standard of living is more in Wichita than it is in Los Angeles or Miami? What's the reasoning behind it? That's the problem. There is no reason behind it other than they can charge what they charge. So I know that wasn't the answer to your question, but I'm assuming if it's related to DaVita, I don't see any positive out of it.
There's been some interest, Dr. Lonte and I have seen from the captive bunch in what we're doing.
Oh, yeah.
Will you talk about that for a little bit? Because when I spoke to the Berkeley bunch, they thought, you know what, if they crush stop-loss insurance, then that's just an opportunity for the captives to kind of take that over, and that's kind of the safety net for a NAIC raid.
Right. From a standpoint of captives, people ask me my opinion of captives. I like them, I don't like them. Anything that promotes interest in self-funding, I'm a fan of, okay? There are many people in the industry that think captives are a waste, that it's not really self-funding if you're also sharing risk with other organizations, so that if my plan is a healthy plan, but your plan in the same captive is not healthy, I have to pick up that risk. It's like a pooling mechanism in a lot of ways. But what I like about captives is that because they're a captive and it's run by, let's say, like a Berkeley, and Berkeley is the most well-known captive organization around. I mean, if you can't read an article about captives without Berkeley being quoted in it, right? What I like about it is because it's all there encompassing, everything is based on finding the most efficient way to do business, finding the best providers to work with. So from my standpoint, captives in this marketplace make a lot of sense, specifically for this crowd, because you're not just working with one employer. When you hook up with a captive, every employer that's in that captive, everybody is part of that relationship with one sign of a pen. So there's a lot more power available if you can hook up with like a Berkeley or any other captive out there and have some type of arrangement in place. The plan documents that I was talking about are all the same. Every plan is written the same. I write the plan docs for the Berkeley captive that they have. So from a standpoint of every plan has the same language, everything is the same, except the difference is, based on the employers, there's still differences in regards to how they operate, but at the end of the day, they all have access to the same cost containment mechanisms as everyone else. So from that standpoint, I think for free market, from this association, having a relationship with captives would make a lot of sense.
Oklahoma just changed their law so that they can compete with the Caymans for that business. So
Caymans, Oklahoma. Not sure which one I'd go to, which conference I'd pick. I'm not sure which ones you'd pick. I'm assuming you pick the same one I would. I'm kidding. Well, look at Vermont. I mean, Vermont's, you know, the green, it's not, Vermont's not just maple syrup anymore, you know? Vermont's big on captives now. It's a smart move. I mean, Dunkin' Donuts, do you have Dunkin' Donuts here? Okay. I have a 5-mile ride to work. I drive by 8 of them. And I stop at 3. I'm kidding. Just joking. Any other? I think I'm out
I
of
have
time.
a question.
Yeah.
Obviously, your rate of success, when you can burrow into a bill, whether it's the employee doing it or you through your people, it must be a pretty successful process. Is the response from systems, from physicians, from hospitals good? It seems to me it probably is.
I would tell you this.
If you can burrow in.
If you can burrow in, and I'll tell you the reason why, and I'll be very honest, the reason we're able to burrow in is that we understand the market, we understand the contracts. I can tell you that if you look at the insurance, the self-insured industry as a whole, 80% of the people in the industry will tell me, oh, it's a network claim, we can't do anything about it. We're one of the first companies to actually tell them, yes, you can. So this is all trailblazing. This is all doing things that really no one's ever done before. Most employers still to this day, if it's a wrap claim, a wrap network, so let's say a person here goes to Disney on vacation, there's an injury there. There's a multi-plan wrap. Those discounts are the best. What, 15%? My mother can get a better discount with her Polish accent than a lot of these discounts are. People don't realize you can get out of a wrap discount very easily. So the point is, are we successful? Yes, but first you have to convince the people and show them, based on one of my attorneys, John Jablon is here, this is what he does all day long. He reviews network contracts to see what can and cannot we do. And then when we get in, yes, we're successful. I mean, we've grown 25% on average per year for the past 5 years. We've been on Inc. Magazine's fastest growing companies list 5 years in a row. And it's not because we're not successful on these particular claims. And the feedback that we get in facilities is very simple. When it's the Baylor, nothing positive. When it's Children's Hospital of Cincinnati, nothing positive. But the other 4 hospitals in Cincinnati that we have direct contracts with for our clients, we have a great relationship. But Children's Hospital of Cincinnati says, hey, we charge what we want to charge. We have the name that we have the charity work that we do. We're not going to reduce our rates. Sorry. Anything else?
Yeah, Adam, thank you so much. I did want to take this opportunity just we have a lot of physicians, we have a lot of facilities here in the room, and I'm sitting here right next to Dr. Dimick, and she's writing down all this alphabet soup that came out of Adam's mouth about, what does this mean? What does this mean? But this was, picking Adam to come to the first Free Market Medical Association conference was very strategic. This is about bringing buyers of healthcare goods and services, the self-funded employer, bringing the sellers, you all, and then facilitators here in the room. We have a few brokers, we have a few other TPAs that are like-minded. We wanted the providers in the audience to get a little bit of an exposure to what's going on behind the curtain in our world, in the buyer's world. Because I said it when I made my opening remarks that when Dr. Smith and I started telling each other the secrets of each other's business, I mean, it became so clear, so fast, that there were so many nonsensical layers that are in our business that if they could be removed, this becomes so much more efficient, where a provider can survive and thrive, and that self-funded employer, all they want to do is they want to find providers, whether it be a big hospital or it is an independent physician. They want to find providers out there that will deal with them honestly and openly, because they want to come to the table honestly and openly. But what has sought to almost destroy our industry is that most of the providers in this room, if a Kempton client walks through the door or a HealthSmart client walks through the door, most providers have been conditioned. You don't really care what's on the front of the card, do you? You look at the back. What's the PPO affiliation? This patient is not an employee of Hutchison Oil Company that is actually funding these claims right out of their revenue, that are just looking for an honest deal. You immediately have been trained by the PPO reps to look at this as a First Health Aetna person, to a provider, they don't look any differently than an Aetna fully insured customer. And Aetna has just beaten you over the head with their contract negotiation. But if we can get the providers to see the self-funded employers and we can all start doing business on a much more level playing field, we really got something. And that's what we've really been able to see just in the few years that we've had this association, that we've been doing this, and that's why we wanted to form this association.
Did you have a question for me?
Comments?
Like, I wanted to have a coffee, you know? I'm just kidding. No, honestly, you have no idea. This means the world to me to be asked to be here. I know I was one of the first guys you called to sign up for membership. I promise you, every webinar I do, every presentation I do, I will talk about this association and try to spread this message because it's working. Midland's Choice PPO, any one of you that work with them, Midland's Choice PPO is writing cease and desist letters to their employer groups, and you know what the employer groups are telling Midland's Choice? Bye. We'll find another way. Literally, that's what is happening this week. That's what's happening with Midland's Choice PPO network. So people are starting to listen, and again, thank you.
Thank you.